Hello my friends, in this video you're going to meet our 56-year-old patient Dawn, who is a nurse. She had a ski accident 15 years ago. Over the last 2 years she's been hardly able to walk. She's seen a chiropractor, she's seen her orthopedic doctor at the local hospital that she works, and the ortho said you're going to need a hip replacement. So she came in to here, Barefoot Rehab, and she was hoping that she would have a lot of adhesion. Check it out in this video with Dawn, and I hope you enjoy it.
I feel it right here. I think it's that sciatic nerve is just flared up.
Right, because that goes, the tracks that go behind.
Right down in here. But if I try to lay my leg flat, my butt, and
Top of the thigh.
Yeah.
The side of the thigh, where it usually goes.
When it happens, it's anywhere between 8 and 10.
Casey said that she has a provocative when she bends out her side and she feels all down the side of her thigh and hip, and what needs to lengthen and extend when she does that movement is all of this tissue. So her hip joint is messed up, but if all of this is congested and causing friction, then this will overwork and she'll be the hip joint symptom referring down. So we're going to see if we can make that test better. That was the femoral nerve that goes down that way. Now I'm checking her lateral femoral cutaneous that comes down right in here. Sciatic nerve is on the opposite side. This is the femoral nerve right here. So we treated a little bit of that coming under. And then the hip joint can get jammed up when people have degeneration or they're expected to get a replacement. So when she's sitting, all of this tissue is closed because the thigh is in this position. So if all the muscles contracting when it's closed up, it'll cause restricted blood flow and the adhesion will come back more excessively. So her femoral nerve right here doesn't want to move, and that's why we're going to treat the femoral nerve under the ligament. Pulling super tight. That's what we want to feel. And I'm just fighting the adhesion to tear it and break it. Everything is sciatic.
In me it is.
Any pain that shoots down from the low back is a sciatic. No, I'm just busting.
I'm just telling you, that's why I'm feeling it.
No, it's just funny because everybody, anything that goes down from the butt that shoots, they're like, oh, my sciatic. We poke around on different areas of her butt and her hip, and she says, my sciatica. There's this thing that when people think that they have any pain that's shooting into their glutes, into their thighs or their legs, they say, oh, it's my sciatica. Well, you could have other areas of the bodies that can shoot as well. It could be your SI joint that shoots, although that's quite rare. It could be your hip joint that shoots, which is what is actually going on with Dawn, because she has a very severely degenerated hip. Radial shockwave, it can help to release stem cells, which is the most important part of the cartilage in the joint. You can improve the cartilage 30%. Radial shockwave therapy is a treatment that we've found releases stem cells into joints, can reproduce some cartilage, releases new blood vessels into joints so that cartilage can be replenished. And you'll see how we use it. It's in a very specific way. We're not just shooting into an area and hoping that the stem cells are gonna go into the hip joint. She has to make sure that she feels the same pain that she feels when she's walking or when the pain is really bad. Is it getting in there?
Yep.
If the shockwave is able to reproduce that pain, it's indicative that the shockwave is actually going into the cartilage where it actually needs to be replenished, where it needs those stem cells and that new blood vessel growth. How's that feel right now?
I feel like I have more range of motion.
Good.
Without pulling.
And 0 to 10 with that test.
2, 1.
2 out of 10.
I don't feel really good.
Casey, 2 out of 10 with that test. What was it before?
It was a 10.
10 out of 10? Good. I'm gonna start using the shockwave more because we've been restoring the muscle integrity. We remove as much adhesion from around the hip so that the muscles are firing properly. Then we start treating the hip joint so that it can regenerate a little bit. You're the best.
You're the best.
You're the best. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe. Stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.